The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, this is Karen Nickell, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. I have some very exciting news to share with my wonderful listeners. For almost 9 years, I have been the host of Itchy and Bitchy, formerly named Sweaty and Pissed. It is time for the podcast to grow and evolve with new hosts and a slightly different format. Growth and change is a good thing. My dear, dear friends, Stephen Miller and Keith Hnilica will be the future hosts of Itchy and Bitchy. As hosts, they will have a comprehensive approach to wellness with a focus on connecting human health, animal health, and environmental health. To provide a transition period for you, for me, and for Stephen and Keith, we have a series of 4 episodes planned. I will introduce Stephen Miller, a fellow nurse practitioner, in the first of the 4 episodes. In the next episode, I will introduce you to Keith Hnilica, a veterinarian. The 3rd episode will include all 3 of us as I interview both Stephen and Keith. All 3 of us will also be in the 4th episode, but this time the tables will be turned and Keith and Stephen will be interviewing me. Good luck with that. I am confident that you will enjoy and learn from all that they have to share. So today I want to introduce you to Dr. Keith Hnilica.
Hello.
Hello. He is a veterinarian and board-certified veterinary dermatologist who has been in practice for 30 years. Lots of experience. He has taught at Auburn University, the University of Georgia, and the University of Tennessee. Go Orange. Keith is currently an adjunct professor at Lincoln Memorial University here in Knoxville. But wait, there's more. He is the author of Small Animal Dermatology Textbook. He runs an allergy and dermatology clinical practice called the Itch Clinic. He is also the medical director of Doc Itchy Medical Supplements. Keith is also a dear friend. Welcome, Keith.
Hello, Karen.
I'm so happy you are here.
Me too. This is very exciting for myself and Stephen and hopefully you.
Absolutely. I trust you implicitly. So, Keith, what I thought that we could do today is pick your brain about pet food, gut health, and diets.
Sure.
All for animals, in other words.
Well, so there's actually a lot of crossover as well. And so one of the interesting things about the human veterinary kind of interaction is that we can do a lot more interesting kind of tests or experiments.
Ooh.
In that trying to get someone to eat the same food for 6 months doesn't really work out too well. But with dogs and cats, we can really restrict their diet and have much more precise control and then say what happens. So some of the information we have on the veterinary side actually is better and more detailed than what's available on the human side.
Yeah, a little more control involved there.
Sometimes.
Yeah. Hopefully.
Depending on the household, yes.
So I want to ask you, see, GLP-1 drugs are all the rage for human weight loss. So are veterinarians using GLP-1 type drugs on animals yet for obesity?
Oh, yes. So veterinary medicine has a long history of stealing human treatments and disease names. I mean, pretty much all of veterinary medicine evolved from the human literature. And so a lot of our names, a lot of our understanding of pathomechanisms comes from the human side. And then as we have more studies, we figure out that maybe it's not exactly the same, or sometimes it's even totally different. But we absolutely don't feel like we have to reinvent the wheel, and we steal whatever we can steal from the human side. So with the advent of the GLP-1 drugs, absolutely, they're starting to be used in veterinary medicine. So the limiting factors are always, first of all, dogs are not human. So is there toxicity in dogs and cats? And it turns out they're not, that this is one of the proteins that are pretty well conserved across species. So we don't have to worry about that too much. The other problem that we have is that if the drugs are very hard to acquire or expensive, which they are right now because they're very trendy, everyone wants them, then that could be a limitation to us actually just getting access in a practical form. A lot of pet owners can, afford a lot of care, but $1,000 a month for a GLP-1 for obesity or even behavioral changes, like cats that are food seeking and driving their owners crazy. Money could be a limitation. So there actually are a few studies. One of the other problems in veterinary medicine that we have is that the studies are generally small. So like where you would do, I don't know, a typical GLP-1 study, maybe 1,000 patients. What's the typical size? Pretty big in humans.
Oh, for something like that, it'd be in the thousands.
Yeah, thousands. Yeah. So we have now, maybe a half dozen studies with dogs and cats that are like 11 animals here, 20 animals there.
Yeah.
And so at that level, we can say, okay, we're not going to kill the patient. That's an important threshold.
Yeah, that is a good one.
Yeah, that's kind of starting place. And then do we have efficacy? And it turns out that we actually do. So like one of the studies I'm familiar with, they looked at, I think it was 22 dogs over a 6-month period of time, and they had almost a 14% reduction in body weight mass, which I think is similar to humans. Is that, what's the number?
Yeah, I mean, typically more than a percentage. Typically, on average, people see a 26 to 30 pound weight loss.
Oh, wow, that's a lot.
But if you're over 350 or 400 pounds, then we see significantly more than that.
Right. And obviously our dogs are not 400 pounds, hopefully. Yes. But yeah, I mean,
weird breed.
Absolutely. This is really, there are a few absolute benchmarks in medical history that are just mind-blowingly revolutionary. And antibiotics was one. How many people died before antibiotics? Insulin was another one, the development of steroids, and that was kind of the whole JFK had Addison, steroids saved his life. And then these GLP-1 are just not only for weight loss, but addiction, for behavioral, like in these cats, there's a study, it's a very small study, but the cats will drive their owners crazy, food seeking 24 hours a day. Yikes. And these compounds seem to help reduce that dramatically. So it's kind of cool.
And speaking of the cost, do veterinarians use compounding pharmacies sometimes to have the GLP-1s compounded? Because that's where a lot of the wellness clinics are going, so that they can really lower the cost to $100 a month instead of $1,200 a month.
Yeah, so the answer is yes and no. So if you're looking at doing a study that you eventually want to publish and have data and try to expand the knowledge base and the literature, you probably need a FDA-approved brand name so that, it's pretty legit and it's standardized and everyone knows what you're dealing with.
Right.
If I just have a patient I want to put on, then I'm probably going to find the cheapest source that I believe is reliable. Yeah. And this is, I'm sure, on the human side too, is you can find sources all over the place, but that doesn't mean it's a reliable source.
Yeah. Mostly it's used in injectable form. So you want to have a compounding pharmacy that has a really good sterile division.
Yes, correct.
That's super important. This is such great stuff. I'm so excited. And we're going to take a quick break. And when we come back, we are going to talk about leaky gut in dogs. Can you believe it? We'll be right back. Welcome back. The other thing is foods for cats and dogs. I'm like, well, what food should I get for them? And what bad things should I be looking for in food? I mean, I also have family and friends who feed them only human food.
Yeah.
Is there a list of ingredients that you say, look at these ingredients, and if this is in there, stay away. Is there something like that?
So I'm going to be the typical academician and answer your question with like 6 answers.
Oh, hot diggity.
So a short history of pet foods that will answer your question. There's light at the end of the tunnel, I promise.
Oh, good.
So dog foods, especially, and then cat foods on top of that, were really, really useful and a game changer in the 1940s and 50s when basically dogs lived outside and they would get whatever the pigs didn't eat because pigs were more valuable than the dogs.
Oh, wow.
So Purina came along, one of the big first companies, and they standardized nutrition with Purina dog chow. And suddenly we had dogs that were much healthier and happier. Mm-hmm. And that led over the 50 years after that to now it's a multi-billion-dollar industry and just, more boutique diets that you can possibly name. As it turns out, for decades, we as veterinarians would recommend that you shouldn't feed human food, no table scraps, that they need to eat their dog food. And that, again, was because we would eat the healthy part of the pork and then give them the pork fat. And then the next day they would have pancreatitis and be sick. So still...
They're back to eating the leftovers, but this time not the pig leftovers.
The human leftovers, right. So pork has a bad reputation in dogs because it makes dogs sick, but it's actually the fat, the leftover pork fat that's making dogs sick. So we're learning more and more and more. And one of my favorite, I do teach veterinary students, so one of my favorite shocking educational points for them is there's been a really big study. Again, most of our studies in veterinary medicine are like 10 dogs, 12 dogs, right? So a really good study out of Finland. I don't know why in Finland, but it's about 4,000 dogs.
Wow.
And it turns out that, again, in dogs, we can control their diet, right? So you can't take your teenager and say, eat only soy and corn for 6 months. That's just not going to happen.
Because they'll be hiding Snickers bars under their pillow.
Or Taco
whatever.
Bell. Yeah. So in dogs, really good studies said they looked at all of these variations of diets. And it turned out that the overall level of inflammation, which we know comes from leaky gut syndrome, we don't quite understand that, but we know it's a problem. But the overall morbidity, which is the amount and level of diseases that the dogs get, is reduced if they have a high variety diet. And what this high variety diet basically was the table food that they would feed the dog. So it wasn't necessarily the leftovers, but it was what the humans were eating. And in Finland, you can imagine that's going to be a lot of fish, more vegetables. It's not going to be the Ruth Chris menu, right?
Right.
So out of these 4,000 dogs, they feed human table scraps, fix a plate for the dog. And the overall level of inflammation, allergy decreases relatively significantly. So all of these years of telling owners that they shouldn't feed table food is wrong.
But you need to set a place at the table. Well, not literally at the table, but you need the way your plate looks should look like the dog's plate. Yeah.
So what I tell my owners in the clinic is that you don't need dog food, and we can talk about a whole problem with emulsifiers and what that leads to leaky gut syndrome. But basically, if you're going to eat a Mediterranean diet, which is kind of the current recommendation, is that what you recommend to your patients? So Mediterranean diet, which is mostly vegetables, fruits, fiber, high fiber with lean proteins. And you fix a plate for you, fix a plate for the dog, and you're great to go. That's probably the best we can do. Cats are going to be a little bit more challenging because they don't really like broccoli and spinach. So that's a whole nother topic. But one of the other big issues with the diet, so now we don't need dog foods, and a lot of the fresh dog foods, like there are a whole bunch of brands that you can order, and it's basically fresh cooked food that comes refrigerated. And it's the same kind of thing. It's just they're cooking for the dog rather than you cooking for your dog.
So it's costing more. Usually.
Yes, but it's easy to get. It comes in a tube, but it's more of a home-cooked diet than like a Kibble diet.
Correct.
One of the big things in dogs, and again, this whole leaky gut inflammation, gut neuro skin axis, is that we have a lot of facts about it, but we don't really know how to fix it. One of the other interesting data points that I think I have a conspiracy theory about it, which I need to educate myself better, but colon cancer is on the rise among young adults, millennials and Gen Zs. And what we know with dogs, again, we can do a lot of different things in dogs that we can't necessarily do in people. But basically, all of the processed foods, anything that's highly processed, and that's dog kibble to Twinkies to Oreo cookies to anything you can think of that's highly processed, basically in a factory, you have to get it to flow through a tube. So it has to flow through a tube, and then it gets spit out into molds. And then it forms a cookie or a Twinkie or a kibble or whatever that is, but it has to flow through a tube. So
yummy.
To get it to flow through a tube, we have to add things like emulsifiers and a whole bunch of different chemicals. And emulsifiers are basically like soaps or shampoos. So what makes it lather and the shampoo slippery is also what can get the processed foods to go through a diet. So if you can imagine in your intestines, you're eating shampoo every day in a dog kibble, what that would do to your skin, but also the aligning of your intestines.
Listen, I'm getting hungry just listening to
I know.
that.
So food with some shampoo in it.
Kibble with shampoo, no less.
So one of the big concerns and that we're now identifying in dogs that probably is true in humans, again, I'm not a physician, is that these emulsifiers actually do break down the gut barrier and permeability. And already in the GI tract, about 1% of intact proteins in your GI system will be absorbed into the bloodstream. If you're eating emulsifiers, if you're adding shampoo to your diet every single day, then that's going to increase. So you can imagine that all of these bacterial components, all of the beef protein you're eating, all of these things are going to leak through the gut. And that's probably a big factor of this whole leaky gut inflammatory cascade.
Right.
Don't know, but I'm pretty sure eating shampoo is not a good thing.
Yeah, I'm thinking I would agree with you on that.
Yeah.
For sure.
Yeah.
I've talked about leaky gut on the podcast quite a bit because I think it's source of a lot of problems for people's health.
It's huge. And dogs too.
And
absolutely.
So you mentioned to me what kinds of foods you should feed your dog or cat. Should we be like carefully measuring how much we feed an animal, or are we just like, here, this is how much I eat, so you can have that much?
So there are two answers to your question.
Goody.
Goody. So this is classic academician. You ask one question, you get 6 answers. But you want to monitor weight. So in America, unfortunately, we have a lot of overweight dogs and people. And really, dogs should be much skinnier because that decreases the risk of arthritis and cancer and all sorts of things like that. So you do want to be measuring calories in and calories out, and you can do calculations, but you can also just monitor weight. So if it's a small breed dog, get a baby scale and weigh them once a month. And you want them, in an optimal weight range, which years ago we just kind of went for good, and now really we're trying to seek optimal. The other thing that happens a lot with dogs is that there's a lot of mythology about having to microbalance the nutrients in the diet. And so that comes around from the board-certified nutritionist work for the dog food companies. And if you're going to balance the diet for 1 million dogs, you probably do want to have sort of micro levels and have a pretty good balanced diet.
Yeah.
But in the real world, the way you eat, and I'm not sure how you eat, I think I've eaten with you, and you eat pretty healthfully, I would say.
Yes, I do. There's proof right there, people.
So everything in moderation is good. So what I typically recommend is you don't want to be feeding the exact same thing every single day, which comes back to this kibble. Do dogs really need dog food? But really, if you're micromanaging the amount of magnesium and calcium per milligram in your diet, great, do it for your dog. If you're just eating a good Mediterranean diet, you're going to get enough variation that is absolutely acceptable. Yeah. So the myth that we have to micromanage dog nutrients, I think, is wrong, that they're just as stable and stoic nutritionally as we are. So if you are micromanaging in milligrams of magnesium, potassium, calcium, do it for your dog. If you're just eating a good, healthy Mediterranean diet, that's perfect.
Yeah. There are probably a lot of people who just grab whatever's cheapest on the shelf for their animal. And then there's somebody who's micromanaging, like you're talking about. I don't even know what that would be exactly because I don't do it. But, cooking gourmet meals or weighing everything or measuring everything out. So somewhere between, I don't really care what bag of food I get, and trying to be a 5-star chef for your animal.
Exactly right. Even, buying a cheap bag of dog food, we have the shampoo and emulsifier issue in there, but that's all processed foods. But, if you bought a cheap bag of dog food but gave some leftover spinach and tomatoes and some salmon, that would be acceptable.
Oh.
I'd be good with that.
Yeah. Oh, well, there you go.
Yeah.
That's surprising.
Yeah.
So you mentioned leaky gut, but do you have a regimen, or some of your vitamins, things that you could do for animals when they have signs and symptoms of leaky gut? And what are the signs and symptoms in a pet? Yeah. Our listeners can know, that must be leaky gut. I better take my dog into the vet.
Yeah, so I would actually love to hear your take on this as well. My take on leaky gut is that we know it's a problem. Yep. We know what some issues are, like the emulsifiers in processed foods for humans or dogs. We know that there are 1 trillion bacteria in the GI tract, over 100 different species, and with diseases, the balance of those different species changes. But we, at least on the veterinary side, we don't really know how to fix it. So we have a lot of theories, but we don't absolutely know. So in veterinary medicine, again, we can, feed very specific things and see what happens. So we actually do have probably about 12 different probiotic organisms that we know improve everything in dogs, from dental tartar to eye staining. They decrease inflammation associated with allergy, inflammatory bowel disease. So we know specific bacteria can do things, but that leaves the 90 other species in the gut that we're not quite sure what to do with. The other reality with probiotics, which is kind of the main focus in animals, variety of diet's good, but probiotics is kind of because people are making money with it, is that it turns out that unless you're refrigerating the probiotic, probably a lot of those organisms are dead or they don't survive the acid in the stomach. And marketing-wise, they're now called postbiotics, so they're dead bacteria that may have some benefit in their cell walls. But so we know it's a problem. We know they have inflammation. They have a variety of chronic diseases, but we don't really know yet how to fix it. So good diet, good exercise, probiotics right now, we don't think they hurt. But we don't know the correct organisms, the mixture, or the doses, at least on the veterinary side. Right. So what's happening on the human side?
We have pre, pro, and postbiotics. And the prebiotic, obviously, I've talked to my listeners about this, is basically sort of an advanced fiber. So do you ever recommend doing a combo pre and pro, or do you just say, make sure they get some fiber in their diet?
Yeah, so we're, again, steal everything we can from human medicine so we don't reinvent the wheel. So we're in the process of this, but just even getting the dogs off of Kibble and trying to add in, a variety of spinach and pumpkin and some just natural foods is kind of where we are. So in dogs, we're not at the advanced fiber or even like measuring lipid profiles in dogs. That's nothing that we're not even close to that level of optimization.
And you don't do things like immunoglobulin through colostrum to reintroduce immunoglobulins into the gut, or
so colostrum is one of my pet peeves. We may disagree with this.
I'm pressing a button. I love this.
So we, as veterinarians, we are very, very focused on colostrum, like baby cows and those kinds of things. Yeah. But so colostrum that has a bunch of stuff in it. But the main thing that colostrum does is it has antibodies, which are large proteins, and they're going to be transferred from the mother's immune system to the baby's immune system and give them a jump start on fighting off infections and those kinds of things.
And we should remind our listeners that colostrum's the first stuff that comes out.
Correct. Within the first 24 hours.
Yeah. Right. Sort of thick stuff before the milk comes in.
Right. So my pet peeve with colostrum is that it's very trendy now. It's in a whole bunch of pet and human supplements.
I know it's in human supplements.
Yes, and it's bovine colostrum that's in human supplements. So the scientific deal with colostrum is that if you're a baby cow within the first 24 hours, colostrum is awesome.
Yeah, I wish I were a baby cow.
If you're a baby cow, after 24 hours, colostrum's not going to get absorbed because the GI tract is closed, and 95% of the antibodies just go into the GI tract and aren't absorbed. If you're not a baby cow, then you really don't get any benefit from cow antibodies because you're not going to get the same diseases cows get.
Right.
And if you're not 24 hours
Unless it's
old,
like mad cow disease.
Yeah. Well, that would be
Just
safe.
kidding.
I wouldn't worry about that. Yeah. So you don't have to worry about that in colostrum. But so unless you're a 24-year-old newborn cow, colostrum is totally irrelevant. It's a source of dairy protein and like a powdered milk, but it is doing no benefit. There are a few other things in there, but for the most part, it's not doing any benefits. All of these supplements with colostrum are, again, unless you're a 24-hour baby cow, it just ain't working. The other thing that when pet owners ask me this, because it's very commonly used, it's trendy, Dr. TikTok says it's magic.
Oh, I gotcha.
But what happened to the baby cow? If you took the colostrum from the mama and the baby cow didn't get it?
Colostrum thieves.
I know. It's like really sad.
That is sad.
So that's my pet peeve. So what do you think about colostrum? Do you think it's helpful in adult humans?
There are supplements that I recommend, very specific, and they have to be written or prescribed. They're not really prescription, but you have to get them from someone, a practitioner who has an account to purchase those things for you.
So medical grade.
Yes, medical grade. And
again, Dr. TikTok is not a thing.
That particular supplement comes with other supplements that are designed for you to take for 12 weeks to heal the gut. And I've seen it do marvelous things for my patients. You can't just be buying it off Amazon. That's the thing. I mean, these are what I recommend to people is medical quality. They have to order it through me. So it's very different than somebody just searching colostrum on Amazon and getting the first thing that pops up.
Yeah. And I do think that we're very much in an era where we have a lot of facts, like you can use this combination product and it helps. The skin is also very slow to respond. The turnover time's 21 to 28 days. So these chronic things don't happen magically overnight. But so the supplement combination, the cocktail works well. But it may be different things in the cocktail. It may be the way they interact. It may be
work together.
Yeah. So one of my actual favorite supplements of all, like I think every single mammal should be on omega-3 fatty acids, specifically EPA, eicosapentaenoic acid. And what we're learning in allergies is that it actually works as like a cofactor where it binds other proteins to decrease inflammation, not just in a single manner. So what we thought was simple turns out that it's, three-dimensional chess, and it's crazy.
Yeah, that's great. I have an allergy sheet that I put together and gave to my patients, and EPA was definitely on the list of things they should take.
Yep.
And, here we are in East Tennessee, the allergy capital of the world. At least I think it is that.
It is. They rank the top 10 cities every year, and the top 6 are in East Tennessee. So it's Knoxville, Chattanooga.
I didn't even have proof.
Yep. Well, there you go. And it's basically because all of the pollen zones from the north, the south, the east just merge right here. And so it's beautiful here. It's lovely, but allergy.
Yeah. Gotcha.
Yeah.
Well, this has been fantastic.
Yeah, very fun.
I think our listeners are learning a lot because I'm learning a lot.
Good. That's the goal.
Yeah, I know. I think so. I want to thank Keith for being with us today, and many thanks to all of you for listening. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings matter. Also, make sure you follow the show so that it will be automatically downloaded. That absolutely matters. I encourage you to visit our Facebook page, IMB Podcast, where you can give us a like or leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. Thank you to Forrest Wenzel, my son, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thank you so much, Forrest. And Forrest continues to thrive at Peabody Music Conservatory and is finishing up his final semester of the master's program. And he has informed us that he has been admitted to the Peabody doctoral program to receive a Doctor of Musical Arts in Composition. His dad and I are so very happy for him. It's fun to see his immense musical talents recognized. If you want to listen to what he's creating, you can go to his website, forrestwenzel.com. Remember that your health is in your hands.